An ankle sprain is actually a tearing, so the ligaments are structures that hold the bones together around joints. And when you twist your ankle, or if you're walking down the street or have a twisting injury, the ankle actually stretches the ligaments. And so the degrees are partial tear is a 1 or a 2. So a 1 is a stretch, a 2 is a partial tear, and a 3 is a complete tear. A ligament reconstruction is actually a surgical procedure, and the lateral ligaments are the ones that we're really talking about here. And if you look here, you see that there's a couple of ligaments here on the lateral side of the ankle, this one here and this one here, and they become either stretched or torn. And so a ligament reconstruction is actually tying those back together with stitches, or possibly even putting it back to the bone and having to tie it or anchor it back to the bone. The first thing that we're going to do is do a good history and physical exam and really kind of determine exactly what the issue is going on with the ankle. We'll probably get an x-ray at that point in time. We'll take a good look at the bones, and based on that, most of the time we try to treat people without any kind of discussion of surgery. Usually we try to put people into a boot or maybe some other brace and try to get them into physical therapy. And the vast majority of people do great with that. Sometimes, if they're not doing well with that, then we may need to get an MRI. If they've done the x-rays, they've done the rehab, and they're still kind of unsure of their ankle, we take a look at the ligaments, we'll take a look at the cartilage, and based on that, we may need to talk about surgical intervention. I like to actually do a ankle arthroscopy, which is making small incisions in front of the ankle and looking inside with a camera. And we would smooth off any cartilage injury or try to see if there's any other injury inside the ankle that may need to be addressed. After we get done with that, then we actually address the ankle ligaments on the side. We make a small incision, usually just a couple of centimeters, and we take the ankle ligaments and again reattach them back to where they're supposed to be. I like to actually use a small graft. Usually it's a synthetic graft, and I use that because it actually improves the recovery in the sense that you actually can go faster. You're usually in a splint for about a week, a cast for maybe 2 more weeks or so, and then we actually get you out and start physical therapy, let you start weight bearing on it, and then most people are back to activity in usually 3 or 4 months. I'm Dr. Jeffrey Levy, an orthopedic surgeon specializing in foot and ankle surgery with Riverside Orthopedic and Sports Medicine Specialists.